Wonderful. We're here today for the Tools to Support School Mental Health Referral Pathways virtual learning session. I'm going to talk us through a couple pieces that allow us to be here together today. I want to welcome you. We are here because we have very generous funding from SAMHSA, the Substance Abuse and Mental Health Services Administration. We are very grateful that they allow us to bring these topics to you, topics that you have identified as high priority topics. And in exchange, they are asking us to get some information back from you at the end of this session. So some of you may have heard about this before. We ask you to complete an evaluation form, but I have exciting news. They have updated the evaluation form, thank you SAMHSA, and made it different and easier to complete. So you all have always been wonderful about completing these. Sharing these with SAMHSA is what allows us to continue to do this work. And so we're hoping that you'll stick around at the end of the session. We'll share a link with you and you'll take a look at the new evaluation. Just take a couple minutes to give us your feedback. So thank you so much for understanding that piece. And let me share a little bit about who we are. We are the Southeast Mental Health Technology Transfer Center located at the Rollins School of Public Health at Emory University. And we have the opportunity through SAMHSA funding to serve states in the Region 4, including Alabama, Florida, Georgia, Kentucky, Mississippi, North Carolina, South Carolina, and Tennessee. And specifically, we're here to promote the implementation and sustainability of evidence-based mental health services in the Southeastern region. And in particular, we are here with the school mental health team. So I want to thank my supporters here. We have Kelly and Josie who are supporting the session today. So really grateful to be part of this team at Emory University and part of the school mental health community. So let's review what we're doing here together today. So our objectives were to really respond to your interests in unpacking more about school mental health needs, particularly around school mental health referral pathways. So today what we want to do is understand and articulate the value of ongoing investment in effective school mental health referral pathways. We're going to talk about how to leverage best practices to build, if these are new to you, or to refine and strengthen pathways that you might already have in place. These are pathways that link schools and providers, students and families to support their student mental health. And then what we're going to land on today is to select and apply easy to implement tools and templates, resources that will help you either build or strengthen your school mental health referral pathway. So that's what we're doing today. And let me tell you a little bit about who I am, your host for today. My name is Dr. Christina Borbay. I'm a senior advisor to the Southeast Mental Health Technology Transfer Center School Mental Health Team. And I've been working with folks in the Southeast through Project Aware and through the Southeast MHTTC for quite some time, probably about 4 years now. Prior to that, I was the project director for the Now is the Time Technical Assistance Center, serving all of SAMHSA's initial cohorts of Project Aware grantees, as well as Healthy Transition grantees and recast grantees. I'm an ally to folks who are doing school mental health work. I'm so grateful to all of you for the work that you do. And I just am deeply committed to advancing the work in this area to make sure that all students have what they need to be successful. So a big part of that is making sure we recognize what students need and are able to link them to supports and services. And that kind of outlined what we wanted to focus on for today. We've heard so much from folks that this school mental health referral pathway, which I'm going to probably say so many times today, but our school mental health referral pathways are just that. We're going to define together what we mean by those linkages. We're going to talk about the benefits and the challenges of a school mental health referral pathway, and I bet you will have some examples. We're going to talk through what are some of the known best practices. And then we have a guest speaker today. So we didn't put that in our announcement, but surprise, we're very excited to have Yvonne Hall from Henderson County, Kentucky. And Yvonne and I are going to talk about what does this look like in the real world. And then we'll land on those resources that I mentioned. So I wanted you all to have a sense of what are the really in-depth resources, and then what are the grab and go resources that you can use to continue to strengthen and advance your school mental health referral pathways. That's our plan for our time together today. We have about 90 minutes together. We will leave a few minutes at the end for the evaluation, but let's jump right in so that we have time to cover all of it. I wanted to make sure that we're all on the same page when we are talking about school mental health referral pathways. I wanted to just highlight for folks that in the slides for the rest of the session, you might see this abbreviated as SMHRP. So that's your school mental health referral pathway. And really what we're talking about here are school-based referral pathways that provide the infrastructure, the processes, the resources, the procedures for identifying, referring, and monitoring whether students, families, and educators are linked to appropriate mental health services within a network of school and community partners. Okay, so that's our official and technical definition. And I wanted to make sure that we're all on the same page. So again, this is connecting students and all of the folks in the mix to each other so that there can be communication about what are the needs, what are the appropriate responses, and where we are in the process. That said, we do have this shared definition. What a school mental health referral pathway looks like varies considerably. So we're going to be talking a lot about what these look like in real life. And so I want you to rest assured, wherever you are in your school mental health referral pathway process, it is right exactly where you're supposed to be, and we can move forward from there together. We know that there's so much variation because each school, each district really needs to accommodate the specific needs and the exact resources that you have available. Another aspect of it is that school mental health referral pathways very much reflect the culture of the school and the community that they're in. So of course, there's going to be a lot of variation. And then another piece, and we're going to check in more about this in just a moment, is kind of how formal or informal these pathways are. So I'm doing a webinar about it. It seems like it must be this really formal, precise thing. But what I want you to know is that the kind of casual mental health referral pathway can work really effectively in some schools. Really structured, specific, kind of protocol-based school mental health referral pathways are going to be a good fit for another kind of district. And so there's not a right answer other than we're approaching it with intention. The other thing I wanted to highlight that really kind of shapes things for each district is the change over time. We know that we're in a moving and dynamic landscape, and so our school mental health referral pathways are never static. They're always changing, and so how they look one year in a district might be different than how they look the next year. So let's just drill down a little bit more as we're talking about the common or universal sense of what we mean by school mental health referral pathways, and we're talking about the variation. I also just want to highlight for today's session that our focus is going to be on mental health today, so school mental health specifically. And as we talk through some of these best practices and tools, we'll know that some of the concepts are going to be applicable to a broader range of student supports, those addressing basic needs like wraparound supports or community school models. Our focus is going to be on the referral pathways that are established to meet the spectrum of mental health and emotional wellness needs of our students. Okay, so that's what you can kind of see in the diagram in front of you here. Again, a lot of this can be generalized. You can broaden your referral pathways to be more inclusive. But today, what we're talking about is around students' mental health needs. And then we really kind of want to think about what needs does a student experience and what resources are they engaged in? How is communication managed across supports? Is it managed across supports? What information is shared between partners? And then we want to consider what takes place in our school or district. What does coordination of information and support look like for your students? And in an ideal world, yes, that magical ideal world, how would it happen? Okay. So all of us are experiencing the dynamic landscape and changes of a school environment. And each of us is engaged in a unique school climate and culture. And so what I wanted to do to kind of set the stage is just kind of get a temperature of the room, see who's here with us today, and get a sense of how you're experiencing your current school mental health referral pathways. And so we're going to go ahead and start off with a poll. But we're not going to open the poll yet, Kelly, as Kelly and I talked about this, and I'm excited to use some of the new features that Zoom has provided us for polling. So if you haven't been on Zoom in a minute, I think they just offered some new features in the last week or so. So I'm going to talk you through it before we open up the poll. What we are able to do now is to offer you these multiple questions. So you can see I have these different categories for how you might characterize or describe your school mental health referral pathway. And so when the poll opens, you're going to see one set of options to respond to, and then you're going to keep scrolling down. Don't press submit. Do not press submit until you see all three sections. So we're going to check in and see how formal versus casual your school mental health referral pathway is, how effective it feels, and then what the status is. Is it something in place or is it something you're just getting started? So there's three different categories to respond to. So as you see them pop up on your screen, keep scrolling down. And when you've covered all three categories, then you press submit. So Kelly, let's go ahead and give that a shot. Okay, so number one is, how would you characterize your school mental health referral pathway? Would you say that it's formal and official, or would you say that it's informal or casual? So pick whatever's closest for you. The second one is, how would you characterize your school mental health referral pathway? Is it effective most of the time, effective some of the time, or not effective? And then number three is, how would you characterize your school mental health referral pathway? Is it new, you're in development or building it? Is it in place and maybe you're here to strengthen it? Or is it out of date, stagnant, or non-existent? So go ahead and take a minute to answer those questions. And Kelly, if you can give me a sense of how many folks have responded.
Yeah, we're at about 60% participation.
Nice. Okay, well, we're going to wrap it up in just a few seconds. So if you haven't clicked on those three categories and put submit, we're going to wrap up the poll and then share results. Why don't we go ahead and do that now, Kelly, share results. Okay. And get a sense of who we have here today. Okay, so when I look at whether we're formal or casual, it's almost a 50-50 split. I love it. And I think that is so often the case. So we're going to talk about what that means. And then I love that we have the majority of folks reporting that we're effective some of the time. We always have opportunity to grow and refine our work. And we'll talk about folks who are feeling like what they have in place right now isn't effective. And then lastly, where are we in the process? So it looks like most people have something in place that they're strengthening. Some folks, about a little over 20%, are new. They're developing their school mental health referral pathway. So for those of you who have something in place, we're going to have opportunity in the chat to share resources and recommendations and best practices. So we'll have tips for everybody. And I hear you, for those folks who feel like they either don't have a school mental health referral pathway at all, or it's so out of date that you may as well not have one. We're going to cover bases for you all as well. So that gives me a good sense. Thank you. We can go ahead and close the findings for that, and I'm going to move us forward. I want to talk a little bit about some of the common elements, right? The common elements of our school mental health referral pathways. So key pieces that we want to pay attention to are that even as individual school mental health referral pathways differ, there are these common denominators that we can establish. These are best practice components that serve as the backbone for this system and can be layered or customized with your own approaches that reflect your students' needs and your school or district's circumstances. One of the most common, so I have some examples here. You can see 1 through 5. So having partners involved in a school mental health referral pathway. So it might be a number of folks who are internal to your school or district, as well as linkages to partners outside. You're going to have procedures that really kind of dictate or describe how you're managing these referrals, timelines, handoffs, thresholds. You'll also likely have some sort of procedures for how you share information about students. And we'll talk a little bit more about privacy laws and those kinds of considerations a little bit later. But this is one of those common denominator elements that most folks are encountering. There's also usually some element, whether it's formal or informal, to gauge whether or not interventions are effective in meeting the needs of the student. And then finally, there's some sort of group or collaborative decision-making process that prioritizes the role of students and their families having a voice in what happens with regard to interventions. So those are the top 5, but there's one other common denominator that I wanted to mention to folks, and you can go ahead and raise your hand or thumbs up me in the chat if this sounds familiar. Very, very often, a school mental health referral pathway is based on a single person being the hub of all of the relationships. So let me know if that's you, or let me know if you know who that person is, right? Is that someone who is kind of just always in the know, always connected to all of the other folks. Often this is because of the person's relationships with all the players in the mix. And oftentimes it's not identified as a best practice, but is one of the most common practices that we see, that there's kind of somebody who really holds that responsibility or holds that role as the go-to person or the linchpin in all of that work that's happening. And so I wanted to just name that. Probably because some of you might be that person, and I really think it's worth acknowledging how important relationships are, and also think about it in the context of sustainability. So making sure that as we are putting our common elements in place, that we're thinking about what's the longevity of the school mental health referral pathway that we're building and strengthening. So if it all hinges on one person, sometimes that creates efficiencies. But if there's a lot of turnover or change, or folks are feeling overwhelmed by the responsibilities, having some sort of combination of folks who are holding the different pieces can be effective. So before we move forward, I wanted to talk about what are some of the benefits. Why do I want to talk about this? Because oftentimes when we say school mental health referral pathways, it feels like something that is on our to-do list. We have to get back and tighten that up or refresh it, or make the changes that we've seen since last year, but it can feel like a chore, it can feel tedious. I wanted to just ground us in what are the values? What are the values of having a school mental health referral pathway that's working for your school and your students? First of all, having some sort of system in place, formal or informal, is going to increase the likelihood that we can serve all students. So again, that is one of our key objectives, is having equity and inclusion in our schools and making sure that all young people are systematically addressed in terms of the potential or the spectrum of need that they might be experiencing. And so having something in place, an infrastructure in place that makes sure that all students are treated the same in terms of access is going to be key for that. The other piece about having a school mental health referral pathway is it can really shape the culture of our school. As I said earlier, oftentimes they reflect the culture of our school, but it can work both ways. And having a solid school mental health referral pathway can really contribute to a positive school climate that nurtures students. I also wanted to mention both individual risk and individual competencies. And so having a school mental health referral pathway can ensure that we are, as early as possible, identifying students who might be vulnerable to risk and addressing their needs. And then on the flip side, it also gives an opportunity for prevention and early intervention that can remediate risk. So making sure that we're building up competencies and investing in strengths and resiliencies. And then finally, when we have a school mental health referral pathway in place, we can make sure that we are covering the full spectrum of supports. Oftentimes, I want to just pause here, oftentimes when we think about school mental health referral pathway, we're only thinking about tier 3. And for some of us, that might mean, well, we're referring out and then our role is done and our hands are washed of it. And that's not really what we're talking about here. We want to talk about a school mental health referral pathway that's reflective of the full spectrum of supports for our young people. So again, these are some of the reasons that we know school mental health referral pathways are important because of the benefits, the value that they have for our staff and for our students. But there are some challenges, and I know you know what these are. So if you want to add to them, feel free to vent your frustrations in the chat. But some of the most common challenges that we face when we are looking at a functional or an operational school mental health referral pathway are workforce shortages and turnover. And that can mean that we feel like we are constantly out of date with who is named in our school mental health referral pathway. It could mean just kind of this continual learning curve or education loop, so that as new folks are cycling in, that they have to be informed about what the referral pathway looks like. So those are some of the key pieces: maintaining buy-in, maintaining partnerships. When there are changes in the workforce, those are all challenges. There's also this consideration around how school mental health referral pathways can vary, right, in terms of service delivery across the state. What's accessible, it is the exact opposite of a one-size-fits-all. And so it takes real customization to maintain alignment and coherence with what's happening where you are. Another challenge is limited funding, right? So limited funding flexibility and varied understanding of how to navigate leveraging funds can really impact what resources we're able to access through our school mental health referral pathway. And so we are constantly kind of reshaping and revisiting that aspect of things, our resource mapping. And then, as I mentioned before, one of our common elements also shows up as a common challenge, and that is the complexity of privacy laws. And in particular, when it comes to school mental health referral pathways, we may need to be navigating HIPAA and FERPA to determine what our information sharing parameters are. And that can be a big barrier because they are complicated and we don't always have the information about how those two regulations or privacy law regulations interface and what that means for how we interact with our partners, whether that's community-based partners, community services like law enforcement or primary care. All of those pieces kind of come into play when we start getting into the school mental health referral pathways. But I'm not going to leave you there. We're not just going to land on challenges. I want to move us towards strategies for success. And that's really what we're going to spend the bulk of our time talking about today. And what are the best practices for school mental health referral pathways? And so there are kind of 4 areas named here that I'm going to review with you briefly. So this is an overview. I just want to mention that to you. An overview to just kind of whet your appetite or help you get a sense of what are the kind of key elements that are going to contribute to a successful and effective school mental health referral pathway. So these 4 strategies are considered best practice to designing or refining your school mental health referral pathway. We're briefly going to review each one. What I want you to note is that using these 4 strategies, they don't need to be sequential. So even though they're numbered 1 through 4, all of these strategies are in place simultaneously and can be the focus. So you can jump in on any of these strategies as the focus of improvement or updates or revisions to your referral pathway process. And I want to just quickly reference here, we're going to talk about it at the end of the session today. These 4 strategies map to SAMHSA's, the Substance Abuse and Mental Health Services Administration's 2015 School Mental Health Referral Pathway Toolkit. So this is a comprehensive resource I'm going to be sharing more about later. But this portion of the agenda is just the overview. I wanted to just highlight that that's where the source, that's the source or kind of the guide for the field right now in terms of best practices. So let's take a look at each of these. The first one is assessing your current approach. So when we talk about defining or monitoring the landscape of your current approaches to referrals, this provides a process for determining what mental health resources and partnerships exist for a school and how to link to them. And so we want to make sure that we're linking students with mental health needs appropriate for the school or community-based services. And in this approach, so this is step 1 of the strategy or stage 1, what we're looking at are establishing referral management systems. So how are you going to manage, monitor, make all of these referrals? Establishing a problem-solving team. And a problem-solving team is just a generic term. It encompasses all of those folks who come together to respond to students' needs. So that might be a PBIS team. It might be a specific tier of a PBIS team. It could be a student support team, an SST. So any of those groups, those collaborations of multiple players who are coming together to address the need and response. And so that's what we mean by problem-solving team. And then finally, in this step, we're talking about mapping resources. So mapping school and community mental health resources. And if you're using a tier-based system, if you're using a multi-tiered system, you want to make sure that you're mapping what are the resources based on what are the tiers. And then there's this opportunity. As you can see, this is a cycle here. There's this opportunity to evaluate intervention effectiveness and then continually inform where we are. So again, taking a look at what are the supports and services available, what's working for which students, and making sure that we're kind of keeping tabs on the effectiveness of these interventions. So that's one of the strategies, assessing current approach. The next one is effective partnerships. So building effective partnerships is a key strategy for success in your school mental health referral pathway. This is about collaborating with external partners to develop a robust prevention and intervention support system at all 3 tiers. And these best practices include things like models for effective collaboration across sectors, understanding cross-sector roles for supporting the mental health of youth, tracking mental health referrals and monitoring intervention progress across youth-serving systems, and legal considerations for sharing mental health information within and across youth-serving systems, and planning for transitions across youth-serving systems. So I'm going to pause here before we move on. What I wanted to note about partnerships, because there are some really wonderful tools to help us shape all of these pieces that I just mentioned. But one of the most common issues that I've heard come up in the Southeast region and more broadly across the nation when it comes to school mental health is the challenge of language. And when we're talking about partnerships, oftentimes what we're doing is we're facing folks who are all on the same page when it comes to serving young people. We all want good things for our youth. We want them to be safe, we want them to be healthy, we want them to be emotionally well. And the language that we use, the jargon that comes up, the models with which we approach this can vary. And so what happens in schools and in education can feel different than what's happening for a community-based provider. And so being really intentional about building partnerships that include universal definitions and understandings are going to really facilitate effective partnerships. All right, I'm going to keep us moving forward. I want to talk about the next set of strategies, which is school-based problem solving. So school-based problem solving is designed to promote the mental health of young people. It gives an in-depth description of the problem-solving processes that school-based teams can use to create individualized intervention plans for young people whose social, emotional, and behavioral needs extend beyond the universal Tier 1 supports provided in the general classroom environment. So in this, where we're looking for best practices that include establishing a problem-solving process, applying a problem-solving model to customize mental health interventions for individuals, and monitoring the mental health intervention effectiveness for individuals. So as I mentioned, like we saw in the mapping current approaches, there is this continuous quality improvement element, looking at effectiveness and using the information that we get, the data-driven approach that we get, to continue to refine our approach to assessing, screening young people, and then connecting them to appropriate supports. So those are kind of the 3 areas that I wanted to highlight as best practices that we want to incorporate into our school mental health referral pathways. And I want to pause here before we move on to the 4th area and just identify that this is a high-level overview. As I mentioned, we don't have to go in order of the 1 through 4. So when any of these things I mentioned to you pop out as, hey, I haven't done that in a while, or you know what, we're doing great in terms of knowing what our resources are, but we could really work on strengthening our partnerships and communication with our partners. It's non-sequential. And so I wanted to make sure that you know in the work that you're doing that you can go ahead and jump in at any point in these success strategies to implement them and strengthen, refine, or build up or renew your referral pathways. So that said, I want to make sure we spend some time on the 4th consideration, and I'm going to highlight a couple pieces about that. So the 4th area is around cultural and linguistic considerations. Okay? And the reason that I pause here, so this strategy overlays the implementation of the other 3 strategies. So it seems like it's a standalone because we listed it as number 4, but really we can infuse all 3 of the other strategies with our cultural and linguistic considerations. And so the cultural and linguistic considerations provide an overview. When we look at this best practice, it provides an overview of cultural and linguistic considerations for building effective pathways considerations might be understanding the disparities in our districts, disparities in mental health services for culturally and linguistically diverse students. It can touch on effective strategies for referring culturally and linguistically diverse students to appropriate mental health supports at school and in the community. So I'm going to pause there because I feel like that's a two-parter. So effective strategies for referral, there we want to be conscientious in terms of not all referrals are going to work for all types of students. And so really thinking about how we make a referral, what's the process, what's the communication pathway, who gets contacted first and how, to create a sense of belonging, to reduce risk of stigma, and to increase awareness and understanding for all students and families. So that's what I mean when we talk about effective strategies for referring. And then the second part of this strategy is around appropriate mental health supports. So again, kind of taking into consideration who is the community that we're serving. And when we're making referrals, what opportunity do we have to connect young people to interventions, to community partners or providers that are likely to offer services and supports that are going to be most relevant to that student and their family. And then the last piece here is around identifying and supporting culturally and linguistically competent practices and intervention strategies among school mental health personnel and community providers. So again, kind of thinking about how to rebuilding up our tiered system of support to include resources that are reflective of the diversity of the community that we're serving. So I want to pause before we move on. I'm going to do a little bit of a deeper dive into this one since it is kind of integral to all of the other three success strategies. But before I do that, I just want to note that there have been in the last 10 years, so as I mentioned, these success strategies are from a 2015 toolkit that SAMHSA developed that are still very much the standard in the field. And it's almost 10 years old. 9.5 years old at this point, and the landscape is evolving and changing all of the time. And I wanted to just pause and acknowledge that factors that shape cultural and linguistic considerations, there have really been advances in school mental health access for all students over the last 10 years and how that intersects with regional and national political landscapes that are trending towards more polarized positions. So really we've seen that landscape kind of shift. And I want to note that historically, these are not issues that have been arbitrated by schools. And so we find ourselves often in these positions that we may not have if we've been in this work for a while. This dynamic may be relevant for consideration when you are building or strengthening your school mental health referral pathway. And I did want to mention that if you're facing issues like this, when you're thinking about how to build a school mental health referral pathway that is going to that's going to be effective, that's going to work and have traction in the community that you're working in the district that you're working in, that communication and how we are creating that pathway can really be pivotal. And so if you would like some tips or some more resources about how communication can shape buy-in or shape support, we do at the Southeast MHTTC have a series that includes information about how to build consensus about what we want for all of our students, which is for them to be safe and well at school. And so that's part of our communication series that I wanted to mention to you if you wanted some more information. But that said, I'm going to move us forward and do, as I mentioned, a little bit of a deeper look at what we mean when we're talking about cultural and linguistic considerations. So, you know, I promised you high level and I'm sticking to it, but I did just want to give you some examples if you wanted to think about this in terms of the considerations for current approach. So that was our success strategy number one. How would we overlay cultural and linguistic considerations? And Kelly, if you could help me with the mute, that'd be great. I'm just going to walk us through this as a concrete example so you can see what we're looking at. So in our, if you look at the top right corner, this is the same wheel that you saw earlier when I was showing you this success strategy for considerations for current approach. And the first step was establishing a referral system. And if we wanted to make sure that we were doing that in an inclusive way, we might ask the question, what cultural and linguistic competencies should a problem-solving team member demonstrate? Right? Given the students that we're serving, what is that going to look like in terms of the culture or the decision-making process? To overlay this into managing a referral flow, we want to make sure that we're asking what sensitivities should the problem-solving team build in people who use the referral system, right? So what do we need to know about the folks who are going to be connected through this pathway, and how can we build in a culture or a protocol that's going to be most appropriate for those folks? For mapping resources, we might ask ourselves the question, what should the problem-solving team do to make sure that they have identified community partners that are culturally and linguistically competent? And at the evaluation stage of that continuing quality improvement, when we're looking at the effectiveness of our interventions, we might ask what cultural values will shape the team members' perceptions and assumptions of the problem-solving model, right? So just checking ourselves to see what assumptions are we bringing to the table and how do those hold up. Kind of baseline questions when we're making choices at this stage might be, who are we helping and who are we harming? So that we're being really intentional and mindful about creating an assessment of our current approach that is inclusive of all of the narratives, all of the experiences of our students and our partners. So just as a highlight, if you wanted to go deeper in this level, for each of these stages, there are about anywhere from 3 to 7 different questions or prompts paired with tools that can help you design an inclusive school mental health referral pathway that's going to ensure that all students and families have access to services. So that's kind of our high-level overview of where we are with our benefits of school mental health referral pathways, with the challenges that we're facing, and then an overview of some of the best practices that we can put into place to make sure that we are strengthening in meaningful ways access to supports and services. I'm going to pause there and see, Kelly, have there been any questions in the chat or any comments that would be useful to address?
No questions thus far.
Okay. So I do want to invite folks to, if you have observations, experiences of your own in any of these areas with regard to best practices or questions that you'd like us to address, to go ahead and put that in the chat and we can keep tabs on that. And then there'll also be a discussion portion at the end of our time together today. As we're moving forward, I wanted to make sure that we connected the dots. So I gave you a lot of kind of conceptual practices. I'm going to give you some very concrete resources, so stick around for that. But I also wanted to link it to what's happening in the real world. And so I'm very, very excited to welcome Yvonne Hall. Yvonne is joining us from Henderson County, Kentucky, and she is the MTSS coordinator and Project Aware coordinator there. I'm going to stop screen share for a moment so that we can all see each other. And I'm going to welcome you, Yvonne. Thank you so much for joining me today. I know you have so much going on, but I wanted to invite you to share a little bit about yourself, your role, and the district that you're a part of in Kentucky.
Thank you for having me. Just to tell you a little bit about my district, we have about 70% reduced lunch population. We have 8 elementary schools. We have 1 high school, 2 middle schools, and a preschool center. We have about 7,000 students, just a little over 7,000 students in our district. And this is my 22nd year with the district.
Did you say 27?
22nd.
Second. All right.
Second.
Well, that's incredible.
Yeah.
That's amazing.
Yeah.
So there's some longevity there. There's some perspective that comes with being part of a community for that long. And so thank you for sharing that. And I wonder if you could talk a little bit about where you find yourself now in year 22 when it comes to supporting school mental health.
So this is my third year as MTS and Aware Project Director. So once I entered into that role, I previously was a school-based mental health professional within the district. So
Mhm.
I went from, as I like to say, in the trenches, being in the schools, into kind of leading my mental health team. And so because I've had the longevity of being here for 22 years, I've seen a lot of things change over the years, and I've seen a lot of things that we've tried that were successful, not successful, just changes after changes, trying to make things more effective. So I will say, being in that row, has a little more challenges with it because people look at you for the answers. And so sometimes you have to put your heads together with multiple other people to find the answers. So just being in leadership doesn't mean that you always know exactly what to do. So I do want to reassure people that are in leadership. If people are asking you for guidance and you're like, I don't really know what to do, you don't have to have all of the answers. So if that reassures you a little bit, you have to work together with lots of different folks sometimes to get to the best place to be most effective.
Well, Yvonne, we have a little over 10 minutes where I'm going to unpack this with you because there's a lot here.
Okay.
And then we'll invite folks who have questions or want to hear more about kind of how you're approaching things. They can put that in the chat, or once we kind of get a little further along, I'll invite folks to raise hand and unmute. But let's just start with what you described in terms of not having all the answers, which I'm gonna hazard a guess and say feels really reassuring to some folks here, and also really disconcerting to other folks here, because I know oftentimes we're just like, oh my gosh, I just want someone to know the answer to this. And my follow-up question for you is, do you feel like part of not having the answer is because it's always changing? Like there's not one right answer because it's always morphing into something else?
Yes, and I came into this current role and position right at COVID. And
Mm,
so I think with COVID, mental health specifically really came to the surface. And then when we re-entered back into school, I felt like there were all these new layers because then students no longer knew how to communicate face to face with individuals as well as they did prior to COVID. I felt like there was challenges in many different areas. I feel like parents struggled. And then parents being able to trust the school system again, like once they come back into the school. So I feel like there was a lot of things that we faced with that. Um, so I would hear people say, well, when we get back to normal. And so I finally would say to people, I don't think there is a normal. I really don't think there is a normal. I think that we are seeing, just in our area specifically, we are seeing kids entering preschool and kindergarten with far greater needs than we ever have before. Like even simple things as far as, it used to be that maybe they didn't have the structure and consistency, and now it's some basic needs are not being met, like they're not toilet trained when they're entering school. So lots of little factors that I feel like maybe I don't want to blame it on COVID, but I think parents really got overwhelmed during COVID, because they had to teach, they felt like, and still be parents and still try to work and take care of their families. So
mhm.
I think there's just lots of challenges that, came along with it during that time.
Yeah, absolutely. Absolutely. And I wonder just where you find yourself now. So I know you've been at it for a while and it's always changing. And so thinking about right now, and earlier in this session we asked folks where they are right now. And so I wondered if you could just spend a moment to describe or characterize your school mental health referral pathway as it's showing up right now. So would you say more formal, or structured, or is it more casual and informal?
So one of the problems that we ran into is we found when we weren't formal is that people would try to catch, a teacher would be walking down the hall and try to catch the school counselor or mental health staff and be like, hey, can you
Mhm.
talk to this kid whenever you get a chance, or this is going on. And it was just hard to keep up with all of that.
Yeah.
And to not forget, I'm one of those people, I feel like I could put a sticky note on my forehead, and by the time I get back to my office, I've forgotten unless I had the sticky note. So we felt like there was a lot of like either someone would forget or someone else would think they were taking care of it. So for us, making it formal, it just helped everyone have more clarity on this is the process and this is how it goes. It
Mhm.
also impacted our MTSS so much easier because then when we went through MTSS, we knew who was responsible for what. And there was just, it eliminated a lot of questions.
Okay, yeah, that's helpful. And then, so you mentioned that you shifted into something that's more formal and that solved a lot of problems. And so one of the other questions that we asked folks about was characterizing how effective their school mental health referral pathway felt in turn, and sounds like this improved some of the effectiveness of it.
Yes, it did. And I will tell you, I will give this learning piece is that I think when we first started to create a formal, we had a real big, long, elaborate way to referral through a Google form that had lots of pages, like 12 pages. And then that really overwhelmed people. But in our mind at the
Wait, wait. We need to say that again.
12 pages.
I
Yes.
need people to hear that. So
Yeah.
it was a 12-page Google form, and
But what
that
but in our
overwhelmed people.
But in our minds at the beginning, we were trying to get as much information as we could.
Yeah.
But in hindsight, people were completely overwhelmed. Even though it was an easy process, it still, they felt like it took too much time. So then
Mhm.
we reevaluated it and condensed it to 4
Okay.
and made people much happier. Another thing that we have always tried to do is I ask for feedback. If you think this is the worst thing you've ever had to do, then tell me it's the worst thing you've ever had to do. If
Mhm.
you have a suggestion of something else to add or take away, please let me know. I'll consider it. I'll see if I can figure out a better way. I'm not the strongest with technology, so sometimes I have to rely on other people to teach me things to make things better. But I think try not to make things so challenging and difficult. It can be simple and also be formal.
Mm. So I'm gonna just dig in a little bit there because I'm curious. So going from 12 to 4 means a lot of stuff had to get cut out. What was that process like? Was it a collaborative process? Who was involved? And how did you decide what were the essential pieces to keep in that 4-page form?
So we have a team of 8 mental health school-based supports in our district. So we
Mhm.
meet as a team weekly. So we sit down together and we're like, okay, what is in this form that we absolutely have to have? So we made sure that those pieces were in our Google form, which is our referral process. And then we developed a Google sheet that could be pulled up on your computer every day. Like when you come in and log in like you do every day, you just pull that up. And
Mhm.
as you see students, some of those other things that we needed to know, they were able to just plug those in there very simply. It was just a running document. And they felt much, much better with doing that system than having to go through an actual form.
Okay, that's helpful to know. And then are there information sharing considerations that you've factored in to that document or any other aspects of your mental health referral pathway?
Yes. So when we train, when we do our mental health training for documentation, we include in that our mental health support staff, our school counseling staff, our FRC or Friskies, our school psychologists also participate in that. And then sometimes we have principals that come to that.
Mhm.
And because those are the folks that are meeting on your MTSS team.
Right.
So we feel like the more you have everyone included within that, the more collaboration you're going to have and working together and people not overstepping and doing the same work twice.
Mhm.
So when we work on that and trying to come up with how should we document, what should it look like, who should be included. So that daily sheet that we ended up calling it, all of those individuals that I mentioned have access to that sheet. So if they're seeing one of those students, they can put a comment in something that they've done so that there's no question when you go to MTSS, you can see everything that's being done for that student.
We have a question, Yvonne. In the work that you're doing, do you have nurses, school nurses that you include, or any healthcare staff who are included in that?
They do not attend those meetings. I do a separate mental health training with them at the beginning of the year.
Mhm.
And then we have, a head district nurse. So if she ever has concerns, she brings those directly to me. And that's usually how we communicate there. They don't get together in our district as a group of nurses, except for one big training before the beginning of the year. So I just try to participate in that and try to answer any mental health questions I can for them to make sure that they feel safe and good in their piece and what they're doing with meeting the students.
That's helpful, thank you. And I do see some questions coming in, but before I get to those, I wanted to just check in and get kind of the full scope of the referral pathway and understand what are the linkages. Well, so I have questions about how you are creating shared definitions to know kind of what are thresholds of different levels of need. And then my kind of follow-up question to that is how are you engaging, or what is the communication pathway with any partnered providers? So folks who might be outside of the district, community-based.
So the school-based system that we use is if there is a student that, let's say it starts with a teacher, that the teacher has a concern about, first step they go is to their school counselor. Sometimes the school counselor will see that student a few times. Sometimes right away, the kid will start really unpacking a lot of stuff, and that school counselor may be like, ooh, this is far beyond what I'm going to have the capacity, the time to do. So we say, the school counselor then makes the referral to the mental health support in their building. Those referrals can also come from a parent, like a parent can reach out and make a referral for mental health staff. We generally try to have it all go through the school counselor, just because we feel like it has a better flow. And then at that time, then the school counselor can say, hey, I've spoken to this kid. I thought I was just talking to them because they were a little upset this morning when they came in. I found out they have all kinds of things happening in their family, really going to need a lot of support. So definitely beyond a tier 1. So I'm going to pass this student to you. So officially, our referrals come through a Google form that is referred from the school counselor.
Okay, and that's still within the education setting, though. Do you do any referrals outside?
Yes. So sometimes we have kids that have such intense need that they need a school-based support for every day. And then they also need somebody that maybe is working on additional things within the family or the environment. So we have at the beginning of, usually in about the end of summer, I reach out to all of the local outside agencies in our community, and I let them know if you're interested in coming to the schools, we would love to have you. But in order to do that, we go through a training where I cover some ethic information with them. And then once they go through that process, they're welcome to come in the schools. We have about 25 community partners within our community that come into our schools on a routine basis. And so some of them spend a whole day there. That's how many they work with.
So they're coming to the school sites.
Yes.
Okay, and so because I know in some districts, and I'm just saying this for the broader audience here, that in some districts, the referral is going to be a community-based referral. So a community-based partner providing services outside of the school. And so I wanted to just acknowledge that is another way a referral pathway can flow.
Yes, and we have several community-based mental health supports that don't want to come into the school but still see our kids. But we do have several that, just because it's easier for the family, for the student to be seen at school, then those outside community partners come into the school to see students.
And are there mechanisms that are in place for this referral pathway that track that the handoff has actually happened and then monitor the effectiveness of that referral?
One thing we try to do is I try to maintain really good relationships with our outside community partners. And just to say to them, when we make this referral, then we follow up and call, hey, were you able to get them? Are you able to see them? And then we just ask them that if they discontinue services for any reason, that they let us know. They don't have to give us a lot of details, but any outside partners that come in, we have a MOA agreement with them so that we can communicate with them. So they're able to say, hey, student was successful. We discharged them off of our caseload. Think they'll be fine just following up with school supports. So we have them to sign in every time they come into our building. And I created a real simple, just like it's not a Google form, it's like a doc to where they can sign in every time they come in the building. And then there's an option for them to put if they've ended services with that student.
Okay.
So we can keep up with it that way as well.
Yeah, and one of the things, and this is just kind of more conversational because I know that you are definitely deep in the work that's happening in Henderson County, but I know that you're also kind of keeping track of what's happening in the broader field. And one of the things I didn't say earlier that I wanted to just say now, and if you want to comment on it, Yvonne, I welcome it, is, you know, that referral pathways, I think we often are thinking about as one direction, you know, where we see a kid in need and we're referring them to an intervention, to a support or service provider to meet that need. And I wanted to just highlight that it can go both ways, because we want to have a referral system for our students who are getting reintegrated into the classroom or reintegrated into campus. So if they're getting referred back in, these oftentimes are some of our tier 3 students who might be referred to a higher level of care or might be off campus for any variety of reasons, and having a referral system that also accounts for reentry so that there's appropriate levels of support, including moving a student from tier 3 down to tier 2, down to tier 1, that we're kind of looking at that. I think in PBIS language, we call it like that lava lamp of a pyramid, so that we know that we want to meet the students on the continuum of need and realize that as they are moving on that continuum, we need to be moving in our referral pathways or in our communication about how to support that young person.
And honestly, depending on what's going on with the student and their family situation, we've had lots of students that have had school-based supports, and then family ended up doing amazing. Student was able to just go back down to tier 1, and then over a summer or over a break or over some life change, then we have to reintegrate. And I do think you made a good point, them going back and forth. I do think that we spend a lot of time in our community really trying to build those relationships with our community partners, because I would say the highest need for youth in our community is mental health and addiction. So those are two areas that I feel like that us working together, because there's so much need, and with our 8 school-based mental health supports, there's no way we could provide all of the services that the students need.
That's such a good point. And so I wanted to ask a follow-up question to that, and then I am going to address, there's some pinging in the chat. Folks want to talk about, loop back to the mental health professionals who are in the schools. But before I get to that, I did just want to check in and kind of ask about how, you know, with that kind of spectrum of need and then across the partnerships, if you could kind of just give us a sense of what that looks like in terms of keeping I know you said you shifted to a more formal referral pathway, keeping that current, because there are so many kind of moving pieces and parts. And so when you're building those relationships with partners outside of the school and within the school, how have you designed that? I mean, are you that person who like holds the keys, like the linchpin to all, or do you have it distributed across folks so that, you know, if you move to Tahiti tomorrow, then it would still all keep happening, Yvonne? And I feel like I know the answer, but I'm going to let you respond.
I love that question. So it previously last year, there was another individual that had access to our Google form and shared that responsibility with me. And she left and went to a different position. So since she has left, we have not put anyone else to have access to all of that except for me. I will say I have an amazing team, and I think they would very easily be able to pick up where we are and continue with what we're doing. But I do feel like what we try to do is if we start something, we try to at least try it for the whole school year. And then at the end of the school year, we reevaluate, because I just think multiple moves within the school year is too confusing.
Yeah.
So we try to give it a little bit of time to see, is this going to be successful? What do you like about it? What do you not like about it? I just had a meeting with my team last week and we talked about one of the crisis reforms that we use. A couple of them were like, not really feeling this assessment. Can
Mhm.
we potentially talk about another assessment or look at another way to do it? So now that I said, that'll be something we'll talk about as the year is ending and we'll kind of look at it for next year. So we do try to spend a lot of time in summer, like reevaluating things and like making changes. Because we definitely don't want to go back and forth because, there's the work that everyone is doing is great work. And I know how hard everyone's working. So I don't want to make it any more confusing than it has to be. So that's kind of how did I answer all of your questions, Christina? I think.
Yes, that's
Okay.
helpful.
Okay.
And if it's okay, I'm going to shift to a question that's been emphasized as of
Okay.
interest to folks who are on the call today, which is looping back to the school-based supports that you're able to offer. And so the question, and I'm going to let you respond to it as you see fit, but the question is about mental health professionals that are employed by the district and who provide supervision.
So I will say that in our district, we have some folks that are licensed, and then we have some that are still working on their master's level education. So I am a CSW, and so I am their immediate supervisor. We have a couple of our mental health supports that are looking to work on starting doing supervision. I always try to help in as best way that I can with that. And support them if they, we had a student that's in the master's program right now, and his program let him integrate groups in a different way than how he's already doing to count that as some of his field placement. But because I am a CSW, so far, I have been able to oversee the individuals that we have had that have been in school.
Thank you.
You're welcome.
I'm gonna address some other questions that are coming up in the chat, if that's okay.
Okay.
And Yvonne, I want to just note that not all of these are going to apply to the work that you're doing in Henderson County, but I just want to acknowledge them for the folks who pose them. I do think, I know this next one that you'll be able to address, which is around telehealth. And so there's some questions here about whether telehealth visits are used in your school, how they're leveraged. Let me see, I think there's one other piece around telehealth. Well, maybe you can just, oh, sorry. And then MOUs that you have with your community partners for in-person or telehealth coming into your building. So if you can describe any of those aspects, that would be helpful.
Yes. So I have only to date had one parent reach out to me about telehealth. And here's kind of how we have addressed it so far. I try to look at for the district, if we do one thing for one student, we have to be able to accommodate if all students need that same thing. When a community partner comes in, they're able to go and work face-to-face one-on-one with a student. For telehealth, I feel like for a safety component of that, you would have to have a staff member that would have to be in the room or present just in case of any kind of emergency need. And we just don't have the staff to do that. So we are not able to do telehealth during the school day. So that is something that we have not taken on and have just had one request of it from it so far. As far as our MOUs, we do every community partner that comes in, we do have an agreement. When I meet with the community partners at late summer, and when we do training, we go over that we will be doing that with the agency. It's very simple language that we use. We just kind of talk about that they're going to do what's best for kids, not intentionally cause any harm, that if we have any type of a conflict, that we will sit down together in a certain amount of time and discuss that out and work that out. They're very simple in wording in what we use. And all the time that I've been doing it, we've only had one conflict and we sat down and worked that out. So.
And then as a follow-up to that, that's really helpful, just understanding the specifics and how that looks in real life. Is there anything in the MOU, or do you have any kind of protocols or procedures around clinical records and how that's maintained in the context of student records?
So as far as our school-based individuals, we document in our response to intervention, we use Infinite Campus, and that's how we document what we're doing. The outside providers that come in, they do their own documentation, and we don't ask for that documentation. That is something they do through billing on their own, and we don't ask for that. Now, sometimes there's collaboration between the school-based individual and the clinical therapists that may come into the school. And so they may collaborate and work on, especially during crisis. If we have crisis things that come up, they may work on those together. But we don't ask those outside providers to share their documentation with us. They keep that on their own because we have consent from parent, and parent gave consent for those services. We just kind of leave that to them as professionals to handle that.
So we are going to have a more open forum for Q&A. I do want to acknowledge and express gratitude to Diane Groen-Kidd from Kentucky, who's also on the call today and providing really helpful and responsive messages in the chat. So thank you, Diane. And if you want to, I'm not putting you on the spot, but if you want to chime in during our Q&A portion, I will welcome you to unmute. Yvonne, I did just want to end this portion of our conversation with a question about what are your favorite or recommended resources or tools or templates? I know you mentioned the form that you have been revising. Are there other kind of key pieces that you feel like are helpful for you as you're coordinating all of this, or helpful for the broader team who are represented in the referral pathways that you have established?
Well, as I mentioned, I'm not super technology savvy, so there may be very more detailed resources out there that I'm not aware of or don't know how to utilize. But we just use Google Forms and Google Docs to do most of our documentation, and that seems to work for us. The one thing I have seen is, because we do have a variety of different ages of our counselors and school psychs and things of that nature. As I mentioned earlier, the easier that you can make it, and the less time that it takes them for documentation, I feel like is an important piece, because I feel like most of us that are truly passionate about mental health for children, we're more passionate about the work than we are the documentation. But unfortunately, we have to make sure that we get that documentation done together as well. But just making it easy, something that is not challenging as far as your technology base and education. I think that's the most important thing.
Could you share a little bit more about the resource that you have access to, which is Infinite Campus? So I'm seeing some chatter in the chat box about wanting to understand more about what this is, who has access to it, and is it where you store? So is it the place that you securely store confidential information from mental health providers who are providing services to students on campus?
So what we use, our Infinite Campus is our school-wide. That is how we keep up with all of our student information. The response to intervention tab that we use for mental health, not everyone has access to that. We have on there who can have access to it. So it's generally the school counselor, the mental health counselor, principal. Sometimes, usually the principals go to those staff to ask questions if there's information they need to know. But primarily, it is the Frisky school counselor, mental health, and that school psychologist that put information in there. We just go in and put kind of a general case note. If there's really detailed information that we wouldn't want anyone else to see, we don't put that in there. We put a very general note on what we're doing. We are looking at potentially starting to bill, and I know once we start to build, that could look a little different. I don't know if they want more detail or if they want it to be more vague. We're always trying to protect confidentiality of students and what's going on with them. So generally in our case note, we are putting in information that is generalized of what we're working on and doing with students. And it's more of, this is our target goals and this is what we're doing, without putting all of the confidential information in that same area.
That is really helpful, Yvonne. I'm so grateful for you just laying it out for us how it is. I love the way you talk about the work and the attitude that you bring to it. And thank you for just kind of mapping out your experiences with us. I know that folks have questions for you. I do want to move us forward to just share some more of the resources. I have about maybe 10 minutes that I wanted to use to share some of the broader resources that folks might want to have their hands on. But Yvonne, I'm hoping that you'll stick around because then we can open it up for discussion. And I also just want to encourage, I know that there's been some clarification seeking, especially from Fran. And I wonder, Yvonne, if you're open to it, maybe you and Fran could do a direct chat. So not in the everyone tab, but you could chat each other directly just to get some more clarification for Fran about what services are being provided in the schools.
Absolutely, yes. Yeah.
Thank you. And I'm going to loop back to you, but right now I'm going to start my screen share again. And I'm going to pull up some of the resources that I want to make sure that you all can walk away with today. So give me one moment to get presentation mode going. All right. So what I wanted to start with, again, kind of just, that's our real world perspective. And I wanted to make sure that you all had some grab and go tools so that you can move forward from wherever you are in your school mental health referral pathway. I want to give you all just a heads up, just real quick, red flag here. I'm going to be showing you some images that have really teeny tiny font, and they are not intended for you to try and squint and read. They are just to whet your appetite for what you will find if you go to the actual resource. And Kelly and Josie are going to be dropping the links to these in the chat. The links, if you don't grab them out of the chat, will also be available after today's session. So you can get them if you just want to get the roller coaster ride of what I'm walking you through. So when I'm talking about comprehensive toolkits and guides, these can be useful if you're building a new school mental health referral pathway, if you want to formalize one that has been more casual or informal so far. And then I also just want to highlight, even if you have one that's in place, these toolkits and guides can be really helpful to you if you just want to jump in and kind of fine tune one part of your school mental health referral pathway, because you don't have to do the whole toolkit to find a tool or a template in there that's going to be useful for the one thing that you want to strengthen. And the very first one I want to mention to you is what I introduced up front in today's session, which is SAMHSA's 2015 School Mental Health Referral Pathways Toolkit. This is a 130-page detailed toolkit. As I mentioned, this image is not intended for you to read. I put it in here primarily because it includes the PBIS or MTSS pyramid, and I know a lot of you use that. But whatever model you're using, this toolkit very likely has useful tools for you. It was developed as part of the Project Aware grant initiative by SAMHSA, and it remains the most comprehensive guidance for school mental health referral pathways. It has relevant research, step-by-step instructions, tools and templates, and it links to additional resources. It also includes examples from real-world implementation. It applies beyond Project Aware, so that word means nothing to you. There's still stuff in here for you. It has a framework that overlays an MTSS or PBIS framework. It contains elements that can be adopted or adapted in a variety of school contexts and needs, and includes in-depth guidance on integrating a cultural lens to the development and enhancement of school mental health referral pathways. There are 5 sections, and each section includes an overview of concepts and research supporting the value in practice. It also includes a stepwise approach to the practice and then specific tools and templates. And if you doubted that this was a comprehensive toolkit, I have excerpted the table of contents here just to give you a sense of all the different pieces that are covered in this 130-page document. So you will definitely find something that you're looking for, or everything that you're looking for, depending on where you're starting and where you'd like to end. But for folks who are like, whoa, Christina, please, that is overwhelming, I would like to introduce you to this version. It's an implementation checklist. It's from Project aware Ohio in 2016, they took that 2015 130-page document and said, you know what Ohio needs? Ohio needs an implementation checklist that distills down what is in that toolkit. And so they created this thing called the Referral Pathways Protocol for Mental Health Supports. Again, you don't need to read the font here on this image. It's just to show you how it takes all of this and distills it down into something that you can use as kind of an inventory to take stock of where you are, or an inventory to help guide you to what areas you want to focus on. It's a 7-step version of SAMHSA's 2015 toolkit, and it basically distills it down into 2 pages within a 6-page document. And just to get a sense of the 7 steps, I have them listed for you here. I'm not going to read them off for you, but you can see each step aligns with one stage of that school mental health referral pathways toolkit. And then each one has kind of a subsection or a checklist or an inventory of best practices that can be happening in any of these areas. So again, if you want the more distilled version, that's available to you. And then I also, I'm going to move us forward, wanted to share some guidance with you. So more recently, we have a very comprehensive document from WestEd. This is called Improving Coordination and Access to Comprehensive School-Based Mental Health Services in California. However, I do want to say that the findings and recommendations do generalize to our work more broadly. So California is a good example, and that's what they focused on. But they really kind of distill it down into some key recommendation areas for conducting landscape assessments, for developing tools and trainings for our LEAs, for supporting effective cross-agency information sharing. Really, this report aims to help leaders make informed decisions about how resources should be allocated and how technical assistance should be defined to effectively support mental health services for students. So I don't want to spend too much time on this, but again, it is a really, really comprehensive research and collection of findings that you may want to apply or use to guide your work. So those are my kind of big picture, if you want it all. But I wanted to also offer you this other format of tools and resources that might be useful for the work that you're doing. And this is in the form of flowcharts or workflows, however you think of them, but they are basically visualizations or illustrations of how to connect the dots. So this very first one comes from the National Center for School Mental Health, and it is the School Mental Health Referral and Triage Flowchart Team Process Mode. So as you can see, it really kind of distills down step by step by step how we are connecting a young person who's facing challenges with appropriate and effective interventions. So again, this could be a model or a template that you use and then customize for what's happening in your school or your district. Another version, so not from the National Center, but I want to show you another version of how you could visually represent what a referral pathway looks like. This one is not a school-based example, but it is from the County of Orange in California and their healthcare agency, and is really kind of mapping out visually. You can see there's kind of like a, if this, go here, if not this, go here, right? It gives you that decision-making tree. And this one is in particular connecting social service agency to a healthcare agency. But I think using this sort of template, you could help connect the dots either within your school or between your school and community-based partners. Again, having those kind of decision-making trees can be a nice quick reference guide for folks who don't necessarily want to go through 12 pages of definitions and stepwise instructions, but maybe having that distilled down into a graphic for a quick reference can be a really useful tool. And then I wanted to share 2 other resources before we get to our Q&A. And so they're listed at the top here. As another from the National Center for School Mental Health is a when to refer handout. And then again, that's just a really helpful example that can help peers, teachers, other school staff, family members, and school mental health staff know when they want to make a referral for a student. And then the other one is the Center for Healthy Schools and Communities Coordination of Student Services Team Guide. And again, these images aren't necessarily here for you to read, But I wanted to share these as an example of how you can illustrate your pathways in terms of relationships. And so some people really think in terms of those relational connections, and these are an example of that using a cost model. It's a roadmap for school and staff partners who are interested in improving the coordination of student support services at elementary, middle, or high school settings. And so again, I just wanted to make sure that you got the overview, that you got the real world story from Yvonne, and that you got some grab and go resources so that you can move forward in creating a school mental health referral pathway that's going to work well for your staff, that's going to work well for your students, and that's going to work well for your families, as well as your community-based partners if you're integrating those folks. And so I'm going to pause there so that we can have some discussion before we wrap up. We have about 10 minutes. But I know once I open it up, it could get really, it could get lively in terms of conversation. So Kelly, I'm going to switch order a little bit because I want to let folks know that in addition to the resources that we're providing here today, we have a broader range of resources available in our school mental health resource catalog. And so I wanted to make sure that folks are aware that we have this available. And I also wanted folks to know that we have more events coming up that are through the Southeast MHTTC. And Kelly, could you share about what we have coming up on the events calendar?
Yes, and Josie will put the link in the chat, but coming up on March 27th from 12 p.m. to 1:30 p.m. Eastern, just like today, we will have the community resiliency model, sometimes referred to as CRIM. We're doing that as a self-care practice to reduce burnout and promote resiliency in schools. So we would love to see you all there. And as always, if you're not able to attend live, you can register and you'll receive all the materials post-event.
Thank you. And so I'm going to pause here in terms of our resource sharing. And I haven't, as I've been presenting the resources, been monitoring the chat. And so, Kelly, I don't know if there's any other specific questions that feel useful for us to address, or well, let me pause there and see what you say.
Yeah, no questions during this resource portion, just the kind of what was beginning to be discussed during Yvonne's portion.
Okay, wonderful. So I want to pause here and open it up for discussion from folks. If you have a question, if you want to raise your hand virtually using the tools at the bottom of your screen to raise your hand, then I can identify you and invite you to unmute. If you want to put a question in the chat for me, for Yvonne, potentially for Diane if you're still around, I welcome that. And then I wanted to make sure that we looped back to a question I saw earlier but didn't get to, which is around what does it look like to do an effective school mental health referral pathway when we're in a really remote or small school setting? And so I don't have it in front of me, but I recall that there was a comment posted from someone who was in a very small district who didn't have school mental health staff or access to those types of resources in their community. And so I wanted to just open that up. Yvonne, I know you've been doing this for 22 years, so maybe you've worked in other settings that are experiencing things like this. I could also invite other folks who are part of the audience today to chime in and share their experiences working in these small rural communities with fewer resources.
So as far as small, were they talking about like the Google form process or like how the community works together?
Let me see if I can find it, but I feel like it wasn't so much about the Google process, just in terms of like, what does a referral pathway look like if there's like 3 of you doing the work for a district that, you know, is going to be just maybe a few hundred students.
Yeah. I think the biggest thing is just making sure everybody's on the same page.
Mhm.
Like as long as, I mean, I don't even think in that situation, you know, that it would have to be a formal process. But I think having it written down of what it's going to look like, so I guess that would formalize it, you know, it is important so that you're just not stepping on toes. I know that if resources are a challenge, that probably brings a whole new component. The one thing I will tell you is that get involved with your this process that your city does. In our community, we're really struggling with mental health. And so I spoke with the mayor and he allowed me to be on a mental health task force for the city. Now, granted, this is completely new to me. I have no experience in this area, but I figure I wanted to bring the knowledge that the school had to share with the community to see like what we could do. So I think when you run into walls, you just have to keep reaching to different avenues to try to get as much input as you can from people that have access to things that you don't. So I wish I could answer more to the real small rule, but
I appreciate that. I'm going to invite Ashley to unmute and ask a question. At the same time, I'm inviting folks to remember we do have an evaluation at the end of the session today. Again, it's really critical for us to be able to report back your information or report back these evaluations to SAMHSA. And so we're going to put that in the chat. If you could make sure that you hold some time to complete that, I'd be grateful. But I don't want to stop the discussion. Ashley, I'll turn it over to you to ask your question.
Hi, I was the one who wrote that comment in the notes that we were discussing. So my question was more about like Yvonne, you've talked about how you have how many different people working there to help out and stuff. And so and I had asked before about nursing and stuff because I'm the school nurse here at my school. So it's just me and a counselor here. That's all we have. We don't have psych, we don't have therapists, anything like that. So my thing was more along the lines like, yes, we have a clinic in our town here that could possibly help out and stuff, but like more along the lines of like, what would you say, or how would you put the process more in a small school setting? Because we have grades the size of 40 and about 470 total for our whole school here in one building.
do you feel, go ahead, Christina.
I was just going to ask you if you could comment on that in about 1 minute, because then we need to wrap up. And Ashley, we can definitely follow up and link you to some additional resources.
Yeah, Ashley, I was just going to say that's completely different than what I'm used to, that small of a setting. So I do think, do you have access to outside providers in the community?
We have the one provider in the area,
Okay.
out of a bigger city, about 30 minutes away. So they do have some people here that travel to the clinic here in town, but they're not always available because they're at that clinic. So we could talk to them about coming over, but it is a limited time availability, not like regularly being available.
Gotcha. I don't know that I can answer that in a minute, Ashley, but I'm
Mhm.
more than happy to give you my email if you
Okay.
want us to have some conversations. Maybe talking it through might spark both of our minds with something to where maybe we can come up with something. But I'll put my email in the chat and feel free to reach out to me.
Okay, thank you so much.
You're welcome.
So I want to take this opportunity to thank all of you. The work that you're doing is so powerful and so important. And I know some of these aspects of it, especially around the linkages and creating these systems to make sure that there's equitable and accessible support for all students can really make or break kind of how we're operating on a day-to-day basis. And so I want to thank you for being part of today's conversation, for letting us know that this was something you wanted to learn more about. I want to give immense thanks and biggest regards and respect to Yvonne for the work that she's doing. And also thank Diane Groot-Kidd, who was able to support some of the responses in our chat today. Kentucky really showing up for us in our school mental health referral pathways work. So grateful to all of you. And again, we're really hopeful that you'll take just a couple minutes to complete that evaluation form. Again, it's been revised, so it's easier to complete than ever before. And we're looking forward to continuing the work with you all. If there are ways that we can support you, please reach out. We'll be providing the slides as well as the recording from today's session. And if you had specific requests, Ashley, I know you did, we'll be following up based on the email you used to register. So thank you so much for being with us today. We're going to leave the session open a little bit longer so that we can share the link to the survey, but wishing you all a good rest of your afternoon. Take good care.